Hi, my name is Stefan Leifert, and I'm with Migraine International Patients Perspective. And with me today is a guest from South Africa. And can you tell me your name today?
My name is Zoloh Millicent Guma. I'm from South Africa in the province of KwaZulu-Natal.
Very good, thank you. Migraine International Patients Perspective is undertaking a project to find out about migraine treatments throughout the world. And Zoloh has graciously given us her time to tell us a little bit about how migraines are being treated in her country. And we're going to start a little bit about asking Zoloh how her migraines are going, a little bit about, your migraine history, and a little bit about how your treatments have gone in the country of South Africa.
Oh, okay. Me and migraine, I started migraine when I was 3 years old. Well, I was born prematurely. My mom was 6 months pregnant, and it was a miscarriage. By the grace of God, I came out alive. And from the age of 3 years, I started complaining with a headache. Then that's how it started. Right now, I've been diagnosed with hemiplegic migraine, and I'm on topiramate and amitriptyline, which are preventative. Yes. Here in South Africa, there's a bit difficult when it comes to treatment in the public sector rather than the private sector. By the public sector.
Can you back up
Yes.
1 second and tell me a little bit about what hemiplegic migraines are?
Hemiplegic migraines, it's when the migraine affects you and the effects and your half a side, it's like a stroke. Then one side of you gets affected, it shows like a stroke, but it's not a stroke actually.
Okay.
Yes. And if it's not treated and if you didn't stand up for it earlier, it could be permanent.
Okay, so the effects from the migraine can become permanent.
Yes.
Okay, go ahead.
Yes, here in South Africa, when it comes to treatment, the private sector, there is treatment from the private sector, but it's a bit more expensive. You have to pay for it. And the public sector, by public sector, I mean the government, there is not much medication, and not everyone has much information about migraine, and migraine is not even in the government's calendar.
Okay, so they don't really consider migraines a disease, is what you're saying?
It is considered as a disease, but I don't think everyone is aware of it.
Okay.
Because even the nurses, the private, I mean, the health workers, most of them don't know about migraine.
Okay. From what I understand, in a lot of circles around the planet, there's not been very much funding for research into migraines, and a lot of it is due to a lack of knowledge, or at least a lack of acknowledgement of migraines as a disease and a disability. Back in as far back as medieval times, they were using just really brutal methods for treatments of migraines. They used to drill people's heads to let pressure out and things like that. They used to send them to sanitariums with I guess what you would call crazy people back then, because they just thought it was a mental thing. So, you know, they never really thought of people with migraines as a serious medical condition, as more of a mental condition. But you know, in the last 40 years, things have advanced a lot with neuroscience. So, so yourself, you with the hemiplegic migraines, do you treat yourself at home, or do you go to the do you use emergency services when you have these severe migraines?
One of the things that my doctors told me, whenever I'm having a prolonged attack, I should go straight to the hospital because I'm using the government hospital, the public hospitals, because I don't have much, I don't earn that much to cover for a medical aid that can cover migraine, because migraine is too costly to cover. The doctor said I should go straight to the hospital and straight to the ER because it is an emergency case. Because that's what he said. Migraine is an emergency case.
Okay. So yes, I know that there are, you know, what they call, I'm losing the word. There's a type of migraine, and for some reason I can't think of the name. It's one of those severe migraines that hits you on one side, and the word's just not coming to me right now. But one of the types of migraines that comes up suddenly and severely is one of those that you know, we should always consider an emergency case. You know, it goes from a 0 to a 10 right away. You know, it's one of those things that you always need to consider going to the emergency room when you have a migraine that incapacitates you to the point where you start to lose your ability to speak, you know, for yourself, where your language portion starts to deteriorate, and your motor portion where you don't think you can walk. That's when you call emergency services, because if we lose that ability, we don't know if it's going to turn into a stroke, because it can. Because neurologists will tell you that being a migraine sufferer puts you at a higher risk of a stroke. Just because the vessels and everything are spasming, you know, it could very well turn into a stroke. Even though it's nerves that are spasming in your head, the blood vessels could become involved. We could become a victim of a stroke. So, you know, that it's a good idea to go to the ER, because they may need to do a CAT scan or an MRI to make sure that it's not going there.
Yeah.
You know, an ER technician, they can look at your eyes and tell by the blood vessels that, whoa, this guy may be having a stroke. You know, we need to get him into surgery or whatever, you know. So yeah, it's a good idea to play it safe when you're having a very severe migraine.
Yes.
I have only had, in the last 10 years, 3 level 10 migraines. And one of them in particular scared my wife, because all I could do that morning was pick up my cell phone and find her name on the call list and hit her number. And she picked up the phone and I didn't respond. And she said, "Are you having a migraine?" And I just said, "Uh-huh." She said, "Do you need me?" And I said, "Uh-huh." And she called her boss and she said, "I have to go." Because that's all I could do. That's all I could do. I couldn't have a conversation with her.
Yeah.
But I had enough in my brain to call, and enough to just barely respond And in retrospect, she should have called an ambulance because she was 20 minutes away. You know, she should have called 911 and had emergency services get here before her. But she drove home and then called them, you know. But I was out of it. I couldn't do anything for myself. I couldn't get up. I couldn't go open the door, you know. But you know, they take you to the ER. They give you that cocktail that they put in you, you know, and it takes the pain away, and you know. But I don't want to go through those. Those are just brutal. So So anyway, in South Africa, it sounds like the government hospitals, what you call the public option, is more like what the United States calls Medicaid, which is only accessible to people of low income. And because of that, it's so flooded with people that those people have to wait a long time to get treatment. And the private insurance, a lot of times insurance companies don't want to pay for the more expensive medications. For example, here in the United States, we have available preventatives like Amovig, Ajovy, and Emgality, which I'm taking. Are those drugs available for you there in South Africa?
Those drugs are only available on the private sector, unfortunately.
Okay, so they would probably be too expensive because you don't have the insurance like we do here, right?
Yeah. Only the public sector, because I'm on the public sector and I'm on topiramate. I think the public sector is only accessing those expensive medication bit by bit, because back then they didn't, I think 5 years back, they didn't have topiramate. Now they are accessing them bit by bit. And I just got a message from one of my fellow colleagues reminding me that the government is on a mission to get a system that will work together with the private sector and to have the low and no income society not to wait too long on queues, which will get a similar service to those on the private sector, but not exactly, because the private sector is quite expensive, but with much similar. It will differentiate with a few things.
Okay. Well, at least they're trying to make an effort to help you out.
Yeah. But I think that would take a long, because with COVID now, things are hectic, and I think there should be 10 steps back.
Oh wow, yeah. COVID set a lot of countries back.
Yeah.
So well, I think this has been very productive, and I know that you've been looking into some other things, and I'd like to do this again when you have more information. We can revisit this conversation and go a little further into this. We want to expand this wealth of knowledge between countries, and migraine sufferers need to know what's available. And I want to thank you for the information you've helped us with today. And I hope that you get the treatment that you need. I know that topiramate has side effects. I know I take it, and yeah.
When I started taking it, I thought, no. Maybe is it my mind, or was it something? And I started posting on a group, and so maybe some people will help me. If I post on the group, I'll get some advice on how to deal with the side effects, because I couldn't stand it.
If your dosage is too high, your nose tingles, your lips tingle, your fingertips tingle,
Mm.
and they call it Dopamax because your memory is a problem. You just feel like you're, not there sometimes. Yeah. We all know about Dopamax. Yeah.
Yeah.
So, so my doctor has lowered the dose, at some times. So, um, the first time I took it, they started me out on 100 milligrams. So, and that was too much.
That was too
So
much.
my current neurologist started me out on like 25 and then slowly creeped it up so I wouldn't get
Yeah.
hit with, all the side effects. So, but I'm on that and Emgality. So,
Oh, yeah.
yeah. So at one time I was on Topamax, gabapentin, and Emgality. So, no, that was the life of a migrainer. So, anyway, thank you for being here and thank you for sitting through take 2 of Migraine International Patient's Perspective. And thank you, Zoloh. And we will see everybody again on the next episode of Migraine International Patient's Perspective. Don't forget to like and share this video. And we'll see you folks next time. Have a great day.